It's a big milestone in the pandemic. The COVID-19 state of emergency ends tomorrow here in San Diego and across the state of California. Good afternoon. Welcome to The 4. I'm Heather Myers.
I'm Carlo Cicchetto. Right now, CBS 8's Kelly Hessedal is live at the County Administration Building with a look back at what we've been through and what's ahead. Kelly.
That's right. Just for some perspective, last year around this time, there were around 30,000 cases weekly here in the county. And this week, there's only about 1,800. So that just shows you how much of a change there has been. Now, I had a conversation with a doctor at Sharp Ray Steele, and here's what she told me.
It's reasonable to say that we're no longer in an emergency. Essentially, this has to do with how do we live with COVID in the long term, because we know it's going to be around for a while, and what's a reasonable strategy to deal with it over time.
And so ending the state of emergency is mostly a formality from a government standpoint, but it can have a real impact on people here in San Diego who don't have insurance. There won't be as many of those free COVID testing sites or free vaccine centers that we've seen the past 3 years. Test kits won't be free anymore. I also talked with Dr. Olulade about the future. How do we prepare for the next pandemic? Since scientists and doctors say it's inevitable, we'll have another one. And she says make sure you have masks on hand. Make sure you're up to date on your vaccines. She says the bottom line is take care of yourself, be as healthy as you can be, because that's your best defense. As for being better prepared as a community, she says we have some work to do there.
Because we haven't increased necessarily the number of people in healthcare, we haven't necessarily increased hospital capacity, we haven't necessarily increased the resources that are available. So you could make the argument that we're not as prepared, and that's just the truth. We have to start to think about things like burnout, both in the community and in healthcare workers. That's something that's an issue. We're still seeing staffing shortages.
And she says this isn't just one entity's responsibility to prepare for the future. She says this is the community, this is healthcare, this is government, kind of all working together to make sure we can prepare for the next pandemic whenever that hits. Carlo and Heather.
What do you have to say about the possibility that if we enter another pandemic, something we know now is possible, if we do get in that situation again, will we be seeing lockdowns again? Have we learned anything different, or is that the way things are going to go?
We talked about that, and it's hard to imagine that people would go along with lockdowns since there was a lot of resistance to that over time. Now, one thing Dr. Olulade mentioned was that she really believes that there needs to be better public relations with public health leaders. She said they need to do a better job of kind of explaining what they're doing, why they're doing it, and the science behind it. She also said there need to be policies in place that really balance protecting the public safety as well as protecting the health of the economy.
Yeah, we really saw the outcome of all of those lockdowns, especially on students who were out of school for a very long time. Kelly Hessedal reporting live from the County Administration Building. Kelly, thanks.